Good afternoon, Kingsborough College. We are excited to have you joining us again today for part of our amazing key lecture series where knowledge empowers you. And today we are joined by an amazing faculty member, an associate professor, Dr. Michelle Billies from our Mental Health and Human Services program, where we're going to have an amazing conversation about mental health, mental fitness, as well as learning about our mental health program and ways that you can stay emotionally well during this time. So Dr. Michelle Billies, thank you again for joining us. We're excited about this conversation, so we'll just go ahead and dive right in. Why don't you just tell us a little bit about yourself, maybe about your background and kind of what brought you to Kingsborough College, and then maybe some amazing information about our mental health and human service program at Kingsborough.
Great. Thank you so much, Micah, for pulling this lecture series together. I appreciate being a part of it. I am both a social worker and a critical social psychologist. I got my PhD in social psychology, but I spent about 15 or 20 years doing a mixture of what we call direct practice in social work, that is working directly with people in need. I worked in homeless services, substance abuse services, LGBT services. So I did spend quite a number of years doing, working with people directly, and then started my private practice, my private psychotherapy practice. But all along, I have also always worked on community-based issues, mostly social justice issues. And that is because as a social worker and as somebody who cares about the world, I'm always thinking about how society and the experiences people have in the world affect their mental health. So I've never been satisfied kind of just focusing on individual or small, family or small group mental health. I've also always wanted to be working on some kind of community intervention. So I've worked for the New York City Independent Budget Office. I did activism, trying to save the welfare entitlement in 1996. I've worked a lot on racial justice in my career and in my thinking and work life. So I started working at Kingsborough Community College in 2012 when I was finishing my doctorate, and then became full-time at Kingsborough in 2013. And I love it. It is such a joy. The students are amazing to me. I feel so privileged getting to work with people who are bringing their lives to the classroom. I mean, all students do, but I really try to take advantage of that. I think my philosophy is collective learning. I think we all have something to offer each other, and especially because I teach from a multicultural counseling perspective. That is that if you're in my class, first of all, you're probably coming from a lot of different cultures. My classrooms, of course, like Kingsborough, have lots and lots of different backgrounds in there. But we're also going to be serving many, many cultures, most of us. I mean, some of us might end up focusing like on our culture. Like if you're Jewish, you might focus on Jews. If you're Black, you might focus on Black and brown youth. But most people end up serving many, many cultures. So I think it's a really amazing experience to get to tap into that natural resource in the classroom where everybody already is bringing so much different cultural knowledge to the room. I will say that we have an amazing faculty in mental health and human services. We have a 2-year degree that is a terminal degree. You can go out and get a job with a mental health and human services degree. You can do frontline work. You can work with homeless people. You can work in a group home for disabled adults. You can work with children with disabilities as a teacher's assistant. There's a lot of things you can do with an associate's degree in mental health. But most of our students do end up going on to getting a 4-year degree, primarily either in psychology. Most of our students who go on to a 4-year degree go to Brooklyn College for psychology. And almost all the rest go on for a BSW, a bachelor's in social work at one of the CUNY colleges or a private institution that offers a BSW, which is a bachelor's in social work. Now, the cool thing about getting a BSW at one of our CUNY colleges is you can almost always get a master's in social work in 1 year after that. And Kingsborough is particularly well respected among both CUNY and private and other institutions, other 4-year institutions, because we offer an internship and because we are just known to be experts, that, we train students very well is what I'm trying to say. So our requirements include 2 semesters of an internship, and that's rare. And the social work schools really like to see that. All the, four-year colleges like to see it, but especially in social work, because it means in social work and psychology, and clinical psychology, it's very important to be out there, learning by doing. And so we have internships in nursing homes, working with children with disabilities, working with students with disabilities on campus. There's a lot of different internships, and one that I teach is in community organizing. Now, community organizing has to do with addressing those social injustices that create mental health conditions. I mean, it creates all other kinds of conditions as well. It challenges in terms of poverty and racism and ableism and transphobia. So there's a lot of issues out there. And community organizing is a way for us to bring people together to address issues that they're facing. So the internship I teach is at the Flatbush Tenants Coalition. And we have 10 students from Kingsborough a semester for 6 hours on Fridays, come and work on issues that are literally directed by the tenants of Flatbush, Brooklyn. And what that means is tenant leaders, people who have come together to address low-income housing issues, direct the work. I don't go in as the professor and say, oh, we should fix the housing issue this way. This is a very grassroots project that recognizes the natural leaders in the community and trains them and trains each other and develops an agenda. Flatbush, Brooklyn has primarily Caribbean populace, that lots of, there's mostly Dominican, Puerto Rican, and West Indian, I guess Caribbean is a better term, population. And a lot of the housing, a lot of the low-income housing and the rent-stabilized housing in Flatbush, Brooklyn is, with Black and brown people from especially those communities, but across the board. I live in the community. I also live in a rent-stabilized apartment building. So it's especially important to me and valuable to me to be supporting the natural leaders of Flatbush to address our housing issues. And it's just great to bring in students to learn about those issues and to learn how to do petitions, educate the community, bring community folks together to hear from public officials, but also tell public officials what the issues are so that we can improve laws, which we've done a lot of. And lastly, I'll say this because it's important for everyone, that the students this semester, we are supposed to be meeting in person to do, community organizing in person. But instead, we are focusing a lot on getting people to sign up for the census, to fill out their census. Now, a lot of people immediately hear census and they go, ugh, privacy. Totally understandable. I really understand people's fears around the census. The problem is that the census is how communities get their money from the government. So at the last census in 2010, only 55% of the people in Flatbush who were eligible to fill out the census filled it out. So you know what that means? Wow. The police get less money. The schools get less money. The health services get less money. Everything you can imagine, garbage service, right? Everything you can imagine is dependent. Government money is dependent on the census to know how many people need it. So we're really working to educate people and also encourage them to fill out the census on behalf of Flatbush. So that's what we've been doing as students.
Wow, that's some amazing work. Thank you for sharing that. It actually brings up an important topic that I think has been in the news, not just nationally, but especially in New York with the sheltering in place orders. And a lot of times where, people take for granted that, sheltering in place, you actually have to have secure sheltering to stay in place. So can you talk a little bit more about just some of the work that, the coalition does, the internship does, and really just how important it is for us to really understand the value of just housing and fair housing and, adequate housing when it comes to just safety and health. Can you just talk a little bit more about that with the role that you play and maybe the role that our students play when it comes to sheltering in place and just housing?
Yeah. Well, I'm pretty devastated to have to report that one of the tenant leaders has died of COVID-19.
Oh, wow. I'm sorry to hear that.
His name was Mr. Paul. He educated our students both semesters last year, and he met the students this year. He was a force. He's one of those people who just put his voice out there, and really cared about Flatbush, really cared about the community. Was such a cheerleader, but also a fierce cheerleader, you know what I mean?
Right.
It just breaks my heart to have to report that. Flatbush Tenants Coalition has been reaching out to its members. It doesn't hold meetings because we can't put people at risk. And you know, one of the amazing things about Flatbush Tenants Coalition is that it's mostly run by elders. So elder Caribbean folks in Flatbush, Brooklyn know a lot. And a lot of them have had to fight a lot. Most of them were immigrants, or are immigrants. Their families, you know, move back and forth between the islands. And so that we really had to hunker down and try to figure out how to support people in home under these circumstances. So mostly the staff that are working from home have been calling all the Flatbush Tenant Coalition members, and there's like 300 of them, plus the thousands of tenants that they all represent. So they've been disseminating information, they've been checking on people, and they've been doing their best to try to keep people afloat with the resources that we have in New York City. There are quite a number of resources that people should know about. You can call 311. We're gonna list them at the end of this call, my belief is. I have my course page, which is its own, it's on WordPress, it's not part of Blackboard, has a lot of coronavirus resources. So, you know, we are doing that, and I am also, as a professor, thinking of the community college students that I teach, and also anyone who's listening, that we're in a privileged position, that we have access to information that not everybody has access to. And we are learning that science matters, that there are so many opinions out there. You go on the internet and you can read so many dissenting opinions, so many conspiracy theories, so many people who've been really have faced health violence. So making sense of the really terrible things that have happened in science, in the name of science, with conspiracy theories, like sorting through all that information is important.
It's like information overload almost. It's like you don't know where to get your information from. There's just so much coming at you.
There is so much coming at you. And I am absolutely an advocate for an informed science-based approach. So we have to know that a lot of bad things have been done in the name of science. And there's a lot of amazing things that have happened in the name of science. But if you dismiss all of science, you are probably going to be putting people at risk, yourself, your family, and the others around you at the grocery store, on the sidewalk. So some of the resources that I have been tapping into are the New York City Department of Health. It keeps a record of the cases, the hospitalizations, and the deaths. It also keeps a record of the cases by zip code. You can go in and see how at risk you are in your zip code.
Okay. So a student can, for example, go to this website, type in their zip code, and it shows exactly all of the data for number of cases, number of deaths, number of people that recovered. This is the website that does that?
Well, you can't quite do it that way. You have to go,
Okay.
I have it on my website, and we'll link it.
Okay.
It's a little bit opposite. You have to like find out the New York City general information first. You don't have to, but to get your zip code information, there's one link at the bottom of the page on the New York City COVID, DOH, the Department of Health COVID page, that has it by zip code, and that's the cases. So you don't know the number of hospitalizations in your zip code. You don't know the number of deaths in your zip code, but you do know the range of number of cases. And basically, the wealthier zip codes have fewer cases.
I was gonna ask that next. Is there any way, when you look at like you said, the wealthier zip codes, are they zip codes with the higher income? what is the correlation to the number of cases versus the zip codes that might have, lower incomes?
Yeah. So it shows a map basically, and it goes by color. So you can see, unfortunately, it's the lower income communities and the communities of color that are more at risk and have more higher rate of cases. I pay more attention to hospitalizations and deaths. I actually mostly pay attention to hospitalizations.
Why is that?
Because we don't have universal testing. I can't go right now and get tested. There are places in New York State, there are places in the country that are starting to be able to have drop-in testing, but you usually have to have symptoms first, and then you have to get approved by whatever doctor you're talking to. So there's still gatekeeping, and there's more testing now, not a lot, but you have to be at risk, you have to show signs, but we know that lots of people have coronavirus without showing symptoms yet, or showing symptoms at all. So in order to assess the risk we're facing, I look at hospitalizations, and I also really just assume everyone has it. In terms of my personal safety, in terms of safety for my 6-year-old, in terms of safety for my building, for the people I see in my neighborhood, I get to go to a park, for the park goers. I wear a mask and I wear gloves, and my 6-year-old actually does wear her mask. It's amazing. I lured her with a toy, a new toy, which she bought into. And she also wears her gloves, which is great because then she's not contracting it and she's not delivering her germs. I absolutely believe in masks. We didn't wear masks for a while. I want to believe that was because we were trying to save them for the hospitals. I want to kind of take a little bit of a step back and say that we are all, so from a mental health perspective, we are all, literally the entire planet, the entire human population is trying to survive a pandemic right now. So yes, how this virus hits is going to be much worse based on your socio-demographics, but everyone's surviving. So when I think about mental health, that is literally hitting our lizard brain, right? We are all trying to survive. And I'm going to break that down a little bit first before I get into some of the ways I think about that for mental health. But the biggest ways I think we're facing survival right now are health survival, financial survival, and for my purposes, mental health. And so I think the people who are most at health risk are the first responders and the medical people, and those with a pre-existing condition. So those with heart problems, lung problems, and who have weakened immune systems, and those who are facing people with coronavirus. So the more exposed you are to the virus, the more likely you are to get the virus and to have more symptoms and face more risks. Because it's, what is it called, loading? It's like viral load. So the more you're exposed to the virus, like the medical people and the first responders, the more likely they are to get it, and the more likely they are to get a higher viral load of it. The next level, and also grocery people, like the people who are working in our essential services, our grocery stores, our delivery people, even our pet stores, the fast food people, so all those folks are just going to be more at risk. Anybody who's employed and has to travel on mass transit is at higher risk. If you're living with someone who's an essential worker who travels on mass transit, or who is living with someone who has it, there's a lot of people who are at pretty high risk right now,
right.
if not immediate risk. So all those folks, I just want as much protection as you can get. And that means there's also, so this immediate risk that some people face is not as dire for some of us. For those of us who have a salary and are healthy, or our lives are taken care of because of our parents or some other source of income, we're not quite as at much risk, but we can make choices. And I think we want to think about that when a conspiracy theory appeals to us, when a theory of, maybe this isn't as bad as we think it is, I do want people to remember that if you need to be really sure that dismissing science is where you want to head, because you're also going to be putting other people at risk if you don't use a mask, if you don't wash your hands, and if you don't, be mindful of the 6 to 10 feet of space. And I say 10 feet because I think it was the New York City Runners Alliance or something like that, said that runners and exercising people actually project their breath farther. So wow. You want to be thinking about your safety and the safety of others. We're all in this together right now. So those of you who are facing financial threat, as I think about survival mode, do your best. If you're a frontline worker, do your best. If you're a medical professional, do your best. There's a lot of people right now who are not going to be able to do self-care, which is what my first recommendation is for mental health maintenance, right? Like, the level of survival that folks who are providing frontline services are under is survival, like literally every day. So put the mask on, breathe, drink water, eat, and rest. That's where we're at right now. Those tens of thousands, hundreds of thousands of workers right now in our city, could it be 1 million? I don't know how many essential workers there are, but they and their families are all under immediate threat of this virus. And so you may not be able to take that hour-long walk or that half an hour walk, but taking a 5-minute break to breathe and eat and drink some water, that will help you survive long enough to get to the other side, where you can get that hour walk, where you can take that 25-minute shower. Like those kinds of things. I just really want to send the message that if you're a frontline worker, if you're an essential worker, just do your best. And the rest of us do our best too. Yeah.
That's a good point, that do your best part. I think a lot of times when, we're talking about self-care and, focusing on things we can do to improve our mental well-being, like you said, some of those people that are, in the thick of it, that are out there day in and day out, they can't always, stop and meditate for 30 minutes or, take an hour-long walk. So that's very important. I'm glad you brought that up about, just doing the best you can to really get through this and, make it to that next day, so that way you can, move up or elevate or, make that time available to take those longer periods of self-care. That actually brings us to a great point that I wanted you to talk about. And I think you already started hitting on that. Some recommendations or some ways or some things that we can really do, to focus on our mental fitness and our mental well-being during this time, of uncertainty and just, information overload. What are some things that, students can do, essential workers, just people in general, both in New York and out of New York? What are some things that you think we can do or that you would strongly recommend we do during this time to support our mental health and mental well-being?
Absolutely. So I want to mention one group that I don't forget before I go to my 4 steps or my 4 thoughts about that, my 4 suggestions. And that is folks who are at risk of domestic violence.
That's a good point. A lot of people forget about that.
Yeah. So children, elders, and partners are at higher risk right now when there is someone who has an especially hard time handling stress. Not only are there people who are just abusing others, already before the coronavirus, and that's hard enough to deal with, but even people who may not be, who kind of have it together most of the time and only kind of really act out or really abuse when they're under stress, well, guess what? Right now is that time. So those of you who are in a family situation where one or more of the members can be physically violent, mentally abusive, emotionally abusive, are unfortunately more likely to be that right now. So I just want to think about safety plans. I want to think about safety plans for your children, safety plans for you as the grown-up, and even safety plans for those of you who don't handle your stress very well. You can go into another room, a bathroom. You can face the wall. You can go under the bed covers. Do things, whatever it takes. If you're the kind of person who explodes, but really does want to try to keep it together, reduce the harm. Try to figure out ways to breathe, leave to the other room, Leave the house. Leave the house without a mask. Just get out of the situation that is, leave your job. You might not keep the job anyway. Do whatever it takes to reduce the amount of stress your body is feeling. And for those of you who are at risk of being unsafe from those other folks, create a safety plan for yourself. Figure out if there's a locked room. Figure out what your kids need to do. Figure out where you can go. Figure out if there's a neighbor who would be open to taking you in. Yes, you might put them more at risk, but having a safety plan means you know where you can go. And Safe Horizons is a great place to call. Also, the New York City Anti-Violence Project for LGBTQ folks are both hotlines you can call to help you make a safety plan. So with that aside, with that degree of safety aside, for most of us, I have, and even those folks, I have an idea. I've been kind of looking at different people's ideas, and I have my own in terms of how to maintain mental health under these circumstances. And the first thing I think about is self-care. Safety is part of that self-care plan. It is all the things you think about, right? Like what I said before in terms of eating well, literally drinking water, staying hydrated, breathing. So some people full on meditate. Awesome. There are lots and lots of apps out there. Listening to nice music and getting 10 minutes by yourself. Just slowing your breathing. Anxiety, one way to think about anxiety is it's a package of feelings. And so if you breathe, you can create a little more room. Now breathing, mind you, might also bring up the emotions, because if you loosen the anxiety a little bit, your grief might come up. Your rage might come up. Other less intense feelings might come up. So yeah, if you breathe more, you may feel more feelings, but you know what? That's okay right now. Actually letting that emotion out a bit, journaling, chatting with, we'll talk about friends soon, but journaling, doing other things that help you release energy, release tension, and take care of yourself, enjoying yourself, reading a book, going for a walk, doing something like that. Self-care. Also herbal immune boosters, anything that you already do to take care of yourself, like I take vitamin C to boost my immune system. Those things are, anything you can do to support your health and your mental well-being is really good for you right now. The second form of mental health care I think about is connection with others. So our relationships, or building relationships in this time, or deepening relationships at this time, is really great. It's very easy to feel isolated. It is really easy to feel overwhelmed, even when you have people around you, maybe because you have people around you. So finding ways to access other people. So hopefully most of us have at least one other person that we can talk to in a pretty open way. If you don't, take a risk. Try someone friendly in your life. If you don't have any people like that, reach out to your social networks online. Call a hotline for the first time. There are lots of ways to connect with other human beings. There's a hotline called NYC Well. That is mostly crisis-based, but I think they can probably get you to, a talk hotline. Maybe if you're part of a church. I know that we have lots of resources through the counseling department at Kingsborough. And so we're gonna, again, add that to the list here. So some of that is for like full-on mental health, like the anxiety and the overwhelm is getting to you, but also it's a way to reach out. You can reach out to your classmates. This is an incredible resource. You're all on probably Zoom with each other or Blackboard or something. Send an email to somebody who is friendly. See
Snapchat, Instagram, Facebook.
I'm old. Please add.
I hear that's what the kids are using now anyway. I hear that's what they're using now anyway. But those are great resources. Snapchat, I heard TikTok. I see a lot of people on that. Facebook. We're really sounding old right now. I'm going to stop while I'm ahead. And Instagram. There we go.
Is that's right?
Yeah, there we go. Yeah, Instagram. That'll work. We're still using that one. There we go.
Yeah. So clearly there can be an overload of screen time, but it's a really great place just to stay connected. And especially for mental health folks, but for everyone, take a risk. Say what you're really feeling. Some people might, downplay that, but other people will go, yeah, me too, right? They'll, so take a risk and be that person who actually throws a little fishing line out there to say what's really going on. But also, if you're the funny one, tell the jokes. If you're the caring one, do that. People do that naturally, so you can keep doing that. Mm-hmm. The third thing I suggest is trustworthy information. Accessing. So this idea of science-based information, and also, journalism, we've lived in a time of fake news and this thing called alternative facts, which are not facts. They are opinions. So I spend a lot of time in mental health just differentiating between opinions and facts. Facts are, reality testing. And there's this, you should look up the phenomenon of gaslighting. If you haven't heard of gaslighting yet, it is a form of messing with people's realities. And unfortunately, there's a lot of people, even in our governments, who are gaslighting the population by giving them false information and then telling us we're the ones who are crazy for disbelieving them. So what we really want to look for are news outlets that have journalistic integrity. Now, journalists, just like medical professionals, social workers, psychologists, EMT workers, have ethical standards. Journalists have ethical standards, and their ethics are to provide information as well vetted and as reliable as possible. So you want to look for, and I'll include some of mine. WNYC is both a radio station and a website, and it provides journalists with integrity report on New York City news, and it's amazing. The Gothamist is another news source. I read The Guardian, which is a US-based and also international-based source of news. So there's a lot of news out there that you can rely on, but find trustworthy information. And what psychologists say is that, from their research, is that trustworthy information lowers stress. If I know that a mask can actually help me and help others from spreading coronavirus, guess what I'm wearing? A mask. So trustworthy information actually also helps reduce stress loads. The last thing I'll talk about is taking action. I'd forgotten.
Taking action.
So one of the things that helps children and helps all of us is a routine. So having as much of a daily routine as you can is very helpful. But taking action also means helping others and being an activist. So helping others is probably a little more obvious to most of us. Helping someone in your family, helping someone in your building, helping someone on your block, helping someone online. And on my personal email, I actually have a list of a few things people can do. So I have, and this gets into activism as well. So activism is the word for taking action in terms of social injustice. And it's a way to do organizing around stuff that is actually getting in people's way to getting the things they need. So on my, my private email, I have a link to a petition to try to get all of us have our rent, our mortgage, and our utilities all forgiven for at least 2 months. So I like that one. That's it.
That's pretty good. Sign me up for that one.
Yeah.
Sign me up.
There's another one that I have, which is it's a bailout for Black mothers, it's a national program that tries to bail out Black mothers from prison because they can't afford bail. Now, if you think about it, prisons right now are under siege because they are boxes where people are encaged and they are at risk of, very high risk of COVID infection. We want to try to get Black moms out of prison before Mother's Day so they don't have to get infected with COVID-19. Now, there are millions of prisoners that are of all backgrounds, all racial backgrounds. This particular project knows that Black and brown people are at more risk of being imprisoned and not having the money to get bailed out. So I'm not, I support all projects that help all prisoners, but this one is just a particular one. So those are the kinds of things you can do online, even during this time. And activism, being active is what our energy, so when you get sad, when you get mad, when you get frustrated, that's literally energy in our body. And if we put it to use by helping others, by maintaining our routines, and by taking action in terms of activism, it literally helps that energy move through our bodies. And that helps our mental health.
Wow, that was some great tips. So just to review, help me out here. Self-care is number one. Well, not in any particular order, I guess, but the top four were self-care, connecting with others, relying on trustworthy information, and then lastly but not least is taking action through the form of helping or some type of activism.
Yep.
Amazing. Those are some great topics. So we're going to wrap it up here. Was there anything else you wanted to add, just to either encourage our students or, recap maybe some highlights that you hit? Oh, we will be posting all of the amazing links and resources that Dr. Billy shared. So along with this video that you're watching online, we will have the links posted to those websites and those support services. So as you're watching the video, just scroll up and you should see those links and those resources made available. And if you have any questions about our mental health program, mental health resources, support, we'll also add those links as well. But Dr. Billy, did you want to add anything before we signed off here today?
I just want to say that I think so many people are doing their very best. And I really trust that students are doing their very best. And reach out. If you're having a hard time, reach out. We're here for you. And if you haven't done, quote unquote, enough homework yet or enough of your classwork, hang in there. We just had spring break. You've got 2 more months to do enough work to pass your classes or to get credit. So please reach out to your professors. We really do want to help you, and we want to make sure that as many of you can stay on track as possible.
Great. Thank you again for that amazing conversation. We enjoy having you today on our key lecture series where knowledge empowers you. We look forward to joining you all again next week. We want to encourage you to stay well, stay motivated, and most importantly, take care of yourself and take care of others. For myself, Dr. Micah Griffin, Dr. Michelle Billings, and Kingsborough Community College, we will see you next time. Have a great day and be well.